So it probably actually answers a question that came in from Bess, who said, how should we manage someone who's had a persistent concussion symptoms for 3 or more months? I guess you've got to do a decent analysis to make sure it is concussion you're dealing with.
Yes.
Which we would learn if we did the complete concussion training, the online training. How long is that training?
So it's a 60-hour course, and I'm not going to lie, it's intense. There's a lot of information, but you do come out with a really good framework. So in answer to that question, how would you treat PCS? I would be looking to find out what was the driver of that PCS, what was the subsystem that wasn't functioning properly, whether that being, as Cam alluded to earlier on, those 5 different pillars. Is it, as something that's related to spicogenic or vestibular, or is it a dysautonomia, or, a blood flow issue? So, there are lots of tools and tricks that will allow us to assess that properly, and then we can put the right treatment into place. Another example, one of my very first patients, and I can mention it because he put it all over Twitter at the beginning. He was a professor of psychology, and he'd been chopping wood in the garden, and the axe snapped and hit him on the head, and he kind of almost knocked himself out. And he'd been around...
He was probably lucky the blunt end hit him rather than...
Yeah, exactly, yeah. He'd been around the country, seeing all the best professors and looking for advice about what to do, and he really struggled to work out. He's obviously a very academic fellow himself, but it was just being able to talk through those sort of subsystems with him and actually really get to the nitty-gritties of the assessment. And he was pretty much sorted within weeks, and he'd been struggling for a long time. So it's very, very treatable.